February is Heart Health Month. Here at Scarborough Health Network Centenary Hospital, staff are on a mission to reduce the amount of visits to emergency rooms. With stunning views of the lake, a walking track, and gym equipment all throughout, this isn't your conventional hospital floor.
And this is a story of community advocacy.
Dr. Joe Ricci heads up the Regional Cardiovascular Rehab Program. In the late 80s, this space was created to provide needed services to Scarborough and Durham region residents.
We had 187 patients who had a heart attack participated in the first cardiovascular rehabilitation program. Now we have 4,000 patients a year.
Ricci has been in cardiology for nearly 40 years. He says massive advances in medicine and various other interventions have cut mortality rates.
The risk of dying after a heart attack one generation ago was in the range of 10 to 20%. But now a person presenting to hospital with a heart attack has an average risk of dying of probably less than 4%.
And rehab programs with customized treatment are helping people get back on their feet, literally and figuratively.
We are recommending that everyone sort of strives to get in the current exercise guidelines, which is 150 to 300 minutes of cardiovascular-based exercise per week.
Exercise therapist Megan Hurley says the philosophy for the staff is simple. Make people feel comfortable and make sure they don't compare themselves to anyone else.
People are also worried sometimes, they have some limitations, some joint pain, things like that. They're worried they won't be able to participate, but coming and speaking with us, we're really able to help them.
Education seminars, resistance training, exercise lessons, this is just some of what the staff does here. To help people with busy schedules, they even offer virtual classes to make it easier.
Moving more throughout the day, small steps are really, really important, and then the exercise will get there. But starting with moving more is one of the best things you can do.
Scarborough Health Network has worked to ramp up the program here. Aside from better health outcomes, there have been better financial ones too.
It costs us about $880 per patient for 6 months, and for that, each patient who participates in turn costs the healthcare system $5,600 less. That reduction is almost entirely related to reduction in use of hospitalization.
As staff celebrate Heart Health Month, Ricci says there needs to be continued awareness of and investment in preventative initiatives.
Once you know you're at risk and you start effective therapy, you reduce your future risk. Cardiovascular disease is no longer the #1 cause of death in Ontario.
To learn more about SHN's rehab program, go to citynews.ca. In Scarborough, Nick Westoll, City News.